Hello, my name is Quinton Fisher. I'm here with Matthew Foulston, and we have this presentation on nurses eating our young, which essentially means bullying, workplace bullying in the nursing field. So, to begin, I'd just like to start with a word of prayer. So, I know we're all going through some tough times here with coronavirus and everything. So, I'd just like to take a minute to pray for everybody. Dear Heavenly Father, thank you that we're all here today in class. Be with us as we go through the rest of our quarter. Keep us all safe and well, and be with our families, Lord. In Jesus' name, amen. So here, to begin our lecture, we will talk about a self-assessment quiz.
Yeah, so to open us up here, I'm going to be giving you guys a little self-assessment quiz, and, I want you guys to think about these questions for a little while, but first let me introduce them to you. They're up on screen for you to be able to read as well. So the first question is, have you ever felt intimidated by another nurse during your clinical experience? Second question, have you ever felt purposefully excluded from the healthcare team in the clinical setting? Third question, have you ever received excessive or unfairly harsh criticism in the clinical setting? And final question, have you ever felt anxious around certain nurses during your clinical or work experience? So I'm going to give you guys a couple minutes here to think about this. I want you to kind of sift back in your memories, thinking about clinicals, all the different nurses you worked with, all the different units you were on. Do any of these questions kind of speak to those experiences?
5 minutes later.
Let's first take a look at what clinical bullying is. So, I'm sure many of you have heard of horizontal violence, which is a type of workplace violence or bullying amongst coworkers. So, nurses eating their young, it's a phrase that refers to the bullying behaviors experienced by nurses in the workplace. Bullying might be work-related, personal-related, and or physically related, and it might include things like withholding information, ignoring, spreading rumors, or intimidating. Now, these things might not seem like bullying at first, but a lot of these things can take a toll on a person and make them feel like they're not welcome in the work environment. I know I personally have experienced some of these things, just even through clinicals, and it really does change how you see the workplace and how you feel.
So taking that into our next slide here, reflecting back on that quiz, that little self-assessment that I gave you guys, if you answered yes to any of the previous questions that we proposed, you have experienced workplace bullying. It might not seem like it. In some cases, some people might feel like that's an overreaction, but the fact of the matter is, if you felt intimidated by another coworker, if you felt excluded purposefully from your healthcare team, if you feel that you've received some excessively harsh criticism or repeated criticism that, is attacking you and your performance unnecessarily, and, it's gotten to a point where you start to feel anxious around your coworkers or your managers, that's workplace bullying. And so, I'm sad to say that if you did answer yes to any of those questions, the fact is that you have experienced workplace bullying, which is what we're talking about right now. And it's unfortunate, but as you can see, it's unfortunately quite common, even for us as students and upcoming nurses.
Yes, unfortunately, nurses eating our young and workplace bullying. Eating our young has been a well-known idiom that has been in use for well over 30 years. So it's really nothing new. In our studies, one researcher even referred to this as a contagion that infects the younger generations, which suggests that it's become a cultural norm. Many see bullying as a rite of passage and workplace norm due to the cyclical nature of this bullying. So somebody will bully another person, and then that person will feel like it's accepted and okay to bully someone else. So that just perpetuates the cyclical fashion. Students and new grads are frequently targeted for this type of bullying because they are new, they don't know what to expect, and they're easy targets. Um, Oftentimes, bullying can occur from different authority levels. So higher levels of authority might take out their anger or might bully lower levels. Example would be a physician going to a nurse, or it could be one nurse with more experience to another nurse or a new grad nurse.
Yeah, exactly. The younger nurses or nurses with less experience are often the main target of this toxic culture because, they don't know quite as much. They're new to the environment. They're still trying to figure things out. And honestly, these new nurses, young nurses, like you're a lot more prone to make simple mistakes in the eyes of the veterans. And sometimes that, that causes them to feel the need to lash out and bully and, harass. And it's not justified in any manner because everybody went through that learning phase. Everybody at one point was trying to figure out their environment. And it is incredibly toxic that it's in any way considered acceptable or normal or, just kind of the culture of adapting to the clinical setting because it really shouldn't be. And it's really dangerous when you have a new nurse that's too afraid to ask for help, to ask for advice, because they've been bullied for their mistakes, because they're still trying to learn, they're still trying to understand. And if they don't have the comfort and the confidence to ask when they need help, to ask for help when they need it, that can lead to some pretty bad outcomes, not to mention, the detrimental mental health that they're already suffering because of the bullying that they've experienced. So moving on to some of the effects that it has on the workforce, I was just kind of touching on that a minute ago here. But workplace bullying can lead to things like poor mental health of the nurses, some decreased collaboration with the team members, ineffective communication, reduced work productivity, poor job commitment. When you think about how you'd feel when you're on the receiving end of workplace bullying, I think it's not too much of a stretch to see how these things could kind of connect. I know me myself, when I think about all of these points, this is kind of like the bare minimum of what I would feel if I was the recipient of workplace bullying. And I think that it would be incredibly difficult to be an active, contributing, effective member of my healthcare team and unit if I was at the receiving end of that workplace bullying. And some consequences of the bullying, in a greater sense, can include poor quality of care because you're going to be so preoccupied and, so emotionally caught up in, in the maltreatment that you're experiencing and trying to compartmentalize it that you're not going to be as focused on the care that you're delivering to your patients, which is obviously a big deal. It also increases the chance for med errors and just mistakes throughout care, in fact. Once again, just kind of leaning on the notion that you're going to be very preoccupied with your feelings and your emotions and the fallout of being, mistreated. And also it can further down the road increase in accidental patient deaths because you're not going to be as attentive. You're not going to be as focused on your assignment and your care. And it can potentially lead you and other nurses alike to make mistakes that could be fatal. And miss details that could be the difference between life and death. And you see, it's not just a matter of working to, be respectful for your coworkers, which is obviously important, but it also then translates to the well-being of the patients that are being taken care of by your coworkers.
One shocking statistic that we found while doing some research here was that out of a sample, 72.6% of newly licensed nurses experienced workplace bullying in the past month. That really goes to show that workplace bullying is still a problem. This survey was taken in 2017, which is very recent. In addition, one study showed that amongst nursing students, bullying was a very big, significant problem. So it wasn't limited to just the newly licensed nurses, but also to nursing students as well. I know, looking, if any one of us looks back at our clinical experiences, I'm sure we can recollect. If it was not us, then maybe someone else who was bullied, another nurse maybe, or another student. But that just goes to show how big of a problem this is.
Yeah, exactly. It's a very widespread problem. And, like Quinton just mentioned there, and I mentioned earlier on, it even goes to include us as nursing students. And, it kind of plants the seed for this mentality that that's just how you treat younger nurses or less experienced nurses. And that can, be perpetuated through time. And it's really not good. It's a cycle that has to be stopped, and it can stop with each of us if we just choose to treat our co-workers with more respect, and the younger nurses or the student nurses with more respect. It's up to us. So another interesting point of data that we found in regards to horizontal violence in nursing is that verbal abuse is by far the most common form of workplace bullying, and verbal abuse itself can take many forms. That can be personal disrespects, talking behind their back, slandering them to other coworkers. There's a number of different forms that verbal abuse can take. But one thing about this that's so interesting is that the majority of verbal abuse comes actually from fellow staff nurses. And so, in consideration of patients' families and doctors and techs, assistants, etc., by far the largest majority of verbal abuse came from staff nurses who were of the exact same level of authority of the nurses that were used in this study. So as you can see here, like we discussed earlier, frequent verbal abuse can cause increased stress, decreased work satisfaction, and higher frequency of error. And those are all really, really bad things when, of course, patient safety and patient well-being is hanging in the balance. Furthermore, it's very detrimental to the nurses and their own well-being. And it definitely not only impairs their ability to work efficiently and effectively, but also impairs their personal well-being, which is something that definitely needs to be looked out for as well.
Now we decided to do some interviews just to get a good idea of not just our own personal experiences, but the experiences of others. So me and Matthew both interviewed a nurse. I chose a nurse with more experience, working 45 years in the hospital, both as an RN and now a nurse practitioner. And I figured this would be good to show the contrast between nurses, older generation nurses and the newer generation of nurses, to see if there's any change in the interview. So the questions that we have are, and I'll just say the question and I'll say the answer to the question afterwards. So, have you seen or personally experienced workplace bullying from another RN? And the person I interviewed said yes. Does this bullying typically come from someone of the same rank, higher or lower? The reply was, I've experienced this type of bullying from both sides, both from the higher positions and lower. So how did this workplace bullying make you feel? It made me feel very anxious and inept. I even felt panic at times. How did workplace bullying make you feel? Very anxious, inept. I even felt panic at times. One thing I noticed was that I only received bullying from females. What do you feel about the suggestion that eating our young is simply part of nursing culture and entry to the field? It certainly is an unfortunate part of the culture. Nursing is already such a tough job, and bullying just makes it so much worse. Do you think ethnic background plays a part in workplace bullying? I'm white, but I've been bullied by many ethnicities. Maybe someone bullies because their victim reminds them of someone with whom they have a negative experience, consciously or unconsciously. I can definitely say that there is some prejudice in workplace bullying.
Yeah, like Quinton mentioned before, we interviewed two nurses from quite different backgrounds. And while his candidate was an NP with 45 years of experience in the hospital, I interviewed a nurse with only 2 years of experience with working in the hospital. This nurse in particular worked on a med-surg unit for 1 year and is now currently working in the emergency department where this nurse has worked for another year. So the experiences are a little bit different, and that'll be reflected in the responses. So as you can see up here on the slide, we have the questions that were posed to the nurse, and I'm going to tell you a little bit about how that conversation went. So when I asked the first question to the nurse, whether or not they personally experienced workplace bullying from another RN, they said yes. They said that it was actually very infrequent. And this nurse in particular actually struggled quite a bit to think of an instance where they were bullied. And it was only through my thorough explanation of what workplace bullying is and its classifications and its many forms that they were able to, at that point, say, affirmably, yes, they had been bullied. The form of bullying that this nurse experienced was difficult assignment loads and micromanagement. They said that once they became a little bit more well-known on their units, they were regularly shouldered with excessively difficult loads that they didn't feel were necessarily fair or appropriate for their level of experience. But they had a bit of a rough relationship with their charge nurse, as that nurse in particular kind of gave off an attitude that they thought this nurse was slacking on the job and not really doing their part, and needed to work a little bit harder. And the nurse believed that that's why they were given the harder assignments, and they thought that it was very unfair. The second question I asked this nurse was, does this bullying typically come from someone of a higher rank, lower rank, or the same rank? And the nurse said that, as previously explained, it was most frequently from their charge nurse. They said that they had occasionally had experiences of bullying with other staff nurses, but it was so infrequent or small in their own assessment that they didn't really consider it bullying. But the most consistent and notable form that they experienced was from their charge nurse, which is of a higher stature. The next question I asked was, how did the workplace bullying make you feel? And the nurse said that they strangely felt that they kind of benefited from it, actually. They said that they felt like they needed to work harder. They felt like maybe the charge nurse actually had a point and maybe they needed to be up more on their game. They felt that they needed to be more self-aware, and they felt that they actually learned from it. It's a bit of an odd response to that question, and it caught me off guard. But the more I thought about it, the more I kind of realized that, this nurse struggled to say whether or not they'd been bullied, and they had a hard time really pinpointing any instances where they felt like that was the case. And so I feel like this nurse worked really hard to kind of take something from it and learn from the experience, even though the treatment that they experienced in that time and place was inappropriate and was, a bad way of trying to teach the younger and more inexperienced nurses. But I do have to say kudos to this nurse for still taking a lesson from it and turning it into a positive. It's great for them. And the next question I asked was, what do you feel about the suggestion that eating our young is simply part of the nursing culture and entry to the field? And the nurse said that they thought it was nonsense. They thought it was wrong. And they thought it really increased the chances of room for error for these younger nurses. It decreases the new and younger nurses' desire to request help, and it creates a toxic work environment for everybody, which puts patients in harm, which is the worst of all. Anything that increases the chance for our patients to be in a place of risk or vulnerability is bad. And I think that's very clear to all of us here. And their main point and main takeaway from this was that, the workplace bullying was terrible, but they especially thought it was terrible because of the effect that it had on patient care. The final question I asked was whether or not they felt that ethnic background played a part in workplace bullying. And they said that they personally didn't feel so because most of the nurses in this nurses unit were all of the same ethnicity. Actually, they said that they were all white, and so they found it hard to say that it was related to ethnicity in any way. So that, that just kind of shows a little bit of the contrast between our two candidates and their perspectives and their experiences. One quote that I wanted to take away from this interview that I thought was really interesting was this. This nurse said, "A lot more of what people say and do is because they have a problem and not you. When they're bullying you, it's because they have an issue that they have a problem expressing. If you want to survive in the workplace, you have to keep that in mind and not let things bother you so much because it's a very rough job." So next up, we have some personal statements. Obviously, as Quinton and I have gone through this whole study process, we've learned a lot about what eating our young and bullying in the workplace, what it looks like in the nursing field. And we had lots of conversations about it and our personal experiences about it. So we felt that it would be good to share our perspective. And just to clarify, we've put our quote-unquote official statements up on this slide for you to be able to review. But to paraphrase, my personal statement on this is that, the whole workplace bullying thing and all of horizontal violence in the nursing field, it carries itself in a cyclical fashion, and it keeps being perpetuated. I remember when I was in my preceptorship, many nurses said that they learned by, getting essentially bullied by this definition by the other nurses around them. And that was how they learned, and they had to learn quick. And they said that it was really tough. They said that it was really difficult and it really stressed them out. But that's just, quote unquote, how things were. And I think that it's up to us to put a stop to it. It's up to us to, break that chain and be the ones that show respect to our coworkers and, welcome nursing students with open arms, metaphorically speaking, and, help be there to coach them and guide them into being the nurses that we want for our future. Because if we're constantly beating down, disrespecting, bullying, and mistreating our coworkers, we're only going to create toxic work environments that are bad not only for our health, but also for the patient's health, which is obviously the complete opposite of what we aim to do as nurses. And I think we need to keep that in mind when we think about how we treat our coworkers and how we interact with our teams.
Yeah, I agree with a lot of things that Matthew said. To me, the most important thing in nursing, really, one of the most important things is patient safety. And there's a lot of things that can be prevented. Workplace bullying is one of them. And as we've shown today, there is statistical proof that workplace bullying can affect patient care and quality of patient safety. So I think really it's just the right thing to do, to try and do our part to prevent it and to stop the progression of the cyclical nature of workplace bullying. Yes, so be an advocate for your fellow nurses and say something next time you feel like you should. We also found recommended action from the American Nursing Association, or ANA, as I'm sure all of you have heard. So ANA suggests that fostering positive interprofessional relationships may decrease workplace violence. And, just having a workplace that is open and everybody feels comfortable, that's really what that means. Also, another thing that can be used is cognitive rehearsal to defend oneself. And that's just putting yourself in that position where you're thinking about, what would I say if this happened to me? And just having those thoughts can better prepare you.
In closing, both Quinton and I just wanted to thank you guys so much for your time and attention. We both had a lot of fun researching this topic, and it was a phenomenal learning experience for the both of us. And we really hope that you guys are able to take something from this as well, and that you're able to, use what you learned here and apply it to your own practice as you move into the nursing field, and help break this chain of bullying and disrespect and horizontal violence that we see in the nursing field. because after all, it can end with us. All we have to do is call it out, don't partake, and be sure to stand up for others when we see it taking place. Once again, thank you for your time and attention, and we hope that you're all well and safe.